Hello and welcome to the GBC. Today we have the honor of speaking with Northern Peak Chiropractic here in Watertown with the owners, Dr. Bethany and Devin McMullen. Thanks for coming on.
Well, we're a nervous system-based chiropractic office. So what that means is we focus on like your brain, your spinal cord, and all those nerves going out to your body. So I think when people think of typical chiropractors, think of like, oh, you're just gonna be popping bones. And yes, we do that, but we're really focused on healing the nervous system. And then that starts at conception all the way until, we have, I think we figured out 90-year-olds the other day. Yeah, that's maybe our oldest patient is 90 years old. So we have seen babies at 2 days old up all the way to 90-year-olds. So, all the way throughout health to create health and wellness.
Cool.
And our, I guess we offer chiropractic adjustments. We also do some soft tissue work as well too. But we keep it pretty simple in the sense of, hands heal the body too. So
yeah. And what is the story behind you guys? Husband and wife, both doctors. How did it all start?
So we met in chiropractic school, and then once we started getting into the business side of things, or really started to be like, okay, we're going to be a couple, we're going to get married, stuff like that. How's this going to work, being a couple? So we started off with looking around for internships and.
Well, first I told him, are we going to America or are we going to Canada? So that's a big thing because I'm not taking both sets of boards. So he compromised and we're in America, obviously. So that kind of happened. And then we started, figuring out internships, found a great one in the cities that really helped us build a business, understand the business aspect of being a chiropractor, as well as, the adjusting side of things. And then...
And it was kind of funny. We were gonna do like buy into a business kind of thing, and then we found our mentor, and he's like, "You guys are way too," he said, "capable of just working under someone." And he's like, "Why don't I help you guys figure this out?" And so then we, like Bethany said, we kind of did a year and a half underneath him, and then threw a dart at the board and ended up in Watertown.
Yeah. Cool. What were some of those initial challenges of starting your own business? Is it your first business, I assume you started? Like what were some of those initial challenges and how did you get through those?
Every business has different challenges. Obviously finding your clientele, finding your niche, but we really were able to mitigate a lot of those big business ones by having a really good mentor, having someone who's involved, who's been there, done that, can help us, skip over some of those, what do we do here? What do we do there? And we don't know. So we just would go to him, ask him, he'd help us out. And then we're able to kind of skip some of those bigger challenges at the beginning. But at the beginning, finding patients to walk through your door, that's how you make a successful business. We went door to door through town, stopped at all the businesses, kind of chatted with them about what we're doing, what we're bringing to Watertown, and then we would also do health talks and screenings, just trying to get the word out about what we do as chiropractors and what makes us different.
Yeah, like Bethany said, I would say like the hardest part was like, are we gonna be able to open these doors and be successful right away? Because that was like the biggest thing everyone said to us is like, oh, in 5 years, that's when you start making your money. And we were kind of like, well, that's not our goal. Like we want to try and be making profit right away. And so it was kind of, I think when we moved here, we knew 2 people in the whole town. And it was like, when we would go back to our apartment, it was like, okay, we're going to make sure we go to 15 businesses every day. And we did that for a month and a half. And then we just slowly built up on our day one, and we were able to open the doors and actually have people come in there, not open them and be like, oh, is someone going to be there? We actually had people on the schedule.
I think we had about 75 people on the schedule before we opened our doors.
Wow. So what would be a tip to like a different business owner who's just like in that same position, new town, new business?
Just get out and be active. Go to businesses, introduce yourself, meet people, kind of like how you guys ended up here, even though it's been 4 years, you knew Tiara. So, just getting your name out there, shaking hands, kissing babies, all that stuff, just getting into the community.
Yeah, I would say too, like, and we always talk about preparation wise too. Got to give Bethany kudos. Like when we were in school, she would she was going on Facebook Marketplace and like finding chairs for us, and we would refurbish them and stuff like that, where we really cut the cost, but we put a lot of preparation. And we always kind of talk to like, oh, we feel like we got lucky along the way. But I also think that was just because we were prepared for these opportunities, kind of like the office building here. We talked about, when we came here, we didn't know where we were going to be. And then this spot just kind of fell into our lap. But I also think we were prepared to move on it, then that was allowed us to like actually get it, kind of thing. So yeah, just being prepared. I think a lot of people have great ideas but don't know where to start, and it's just like getting that game plan moving forward for it.
Yeah. And you guys seem to have a couple techniques you guys do that are unique to you guys, or you're passionate about. Why are you passionate about those? And if you want to maybe do now a deeper dive into like what exactly you're doing.
So Dr. Sarah and I, she's the other chiropractor here, we really focus on adjusting moms and babies here. Because like I talked about, we start with conception all the way until you're 90 years old. So it's really important for moms to come in while they are pregnant to make sure their nervous system is healthy, and so that baby's nervous system is healthy as well, and they get the best start to life. So we are both trained in the Webster Technique. It helps align the pelvis, align the nervous system, making sure that baby has the optimal space to grow, those nerves are functioning properly, and then also when you're getting ready for the labor and delivery side of it, that it's quicker, easier for mom, less pressure on that baby, less intervention that's needed by the doctors. So that is kind of where we come in. One of the techniques that we use that I would say specialize in. And then we also see lots of babies in the office as well, because when they come through the birth canal, there's lots of pressure on that neck. So that's where, like I said, we've seen them at 2 days old or even, weeks old, but really get that nervous system checked so they have a better start to life, and then they can grow into healthy children instead of having to fix sick children.
Mm-hmm. Yeah, and then the other technique that we both of us can do, obviously I can work with moms and babies as well too, but our other technique we use is called TRT. It's an instrument-based technique that is all about the nervous system. And again, we say that a lot, but we're looking at the tension in the spinal column, and we use the Achilles reflex actually to look at that, and then we pressure by the base of the skull. There's 14 spots in the skull area, neck, that can be subluxated, and when they're subluxated, it puts tension on the spine. So essentially what TRT does is it goes off at a certain frequency that allows the body to kind of recognize that there's a tension there, and then that helps relieve that tension. So what we found, and it's a technique that's been studied and researched on, and I think it's 14 different techniques kind of built into one. So it was really cool just learning it. And then what we found with it is, we've done patients where we don't use it, and then patients that we have, and we've really found that the patients that do just get functionally better. And I guess what I mean by functionally better is like better results with like sleep, concentration, and energy. And then we also see really good results when people come in with like migraines and headaches, because what's just essentially happening is the body's relaxing, the nervous system's relaxing too.
For that technique, how do you find where there's tension?
Yeah, so that's a great question. So it's a lot of pressure points. So what we do is we pressure by the base of the skull, and then we go back down to the feet. We do the Achilles reflex check. If that shows that that's where the tension is, and it's through all the feet, if the feet are even, that's where I know the tension is. So it's a little harder to explain. It's easier to show kind of thing, but there's about 14 different steps that we can go down to find the exact spot.
Okay.
Yeah.
Cool. Are there a success story or two, maybe in both sides of both techniques, that comes to mind that's like a dramatic transition from when they came in to when they left here?
Probably one of ones that I saw recently, we have been adjusting a little boy. He's about 5 years old. He was going to school, having really big outbursts. He was crying going in. The teachers were like, we don't really know what to do with him. And the mom was taking him to PT, and the PT was like, his hips seem funky. Like maybe go to a chiropractor and check out his hips. So they came here, we started him under care, and I think in like 2 weeks, he was not having the outbursts anymore. His nervous system was able to calm down, especially through torque release technique, and really be able to like get to that stage where, he's going to start kindergarten next year. So having that good foundation where we hear about kids in kindergarten being fidgety in their chairs, all of this, the big outbursts. So the mom and dad were super grateful. It worked really well on that little boy. And like, when we were talking about having to medicate them or, pull them out of classes because they're being disruptive, like it's really great to see like, hey, this kid's nervous system is functioning properly and is calmed down as well.
Well,
yeah, and another patient that we had, she was an older lady, came in for her typical like neck, low back pain, stuff like that. And then as we got through care, she just actually told me this week that the first time in 6 years, I believe it was, she's had 2 weeks of regular bowel movements. And yeah, something that she hasn't been able to really do. And she was like, I didn't really attribute it to you guys until I didn't come in for a week, and then I came back to you guys, and she's like, then it got regular again. And she's like, it was really cool to see that. And then I do have another one where with chiropractic care, maybe not so much with the torque release, but just overall chiropractic care with low back pain and the body as a whole. But I had an older lady as well that she was going through life, I think the last 2 years, where she couldn't put her socks on by herself. And it's like, to me, that's mind blowing that people go through that much pain that they can't do regular things like that. And as we went through care, I just like casually brought it up, like, oh, like, are we able to put her shoes on and stuff? And it was just like nonchalantly, she was like, oh yeah, I've been doing that for weeks. And it's like, we haven't been doing this for 2 years, and like, it's just so easy to come back to, right? So yeah, it was great to see.
is there a typical, like, either expectation? I know it probably depends on each person, but what is your guys' goal when they come into it? Are you hoping to get them in and out, or like what's the typical stay for a client, and kind of what are your expectations going into it?
So that definitely like depends upon the person, obviously, but what we are is like, we want to be part of your health and wellness regimen, So yes, we want to get you out of those aches and pains at the beginning, and then we want to move you into function. So better function. So we're talking, better sleep at night, better bowel movements, more consistency just with your life. Like on some of our paperwork, we ask, have you been drinking more water? Have you been exercising more? Like those little things in life that they always say yes to after they've started chiropractic care. But if you're out of pain, you feel better, you are getting better sleep, it's like, yeah, I can go work out and it's not that big of a deal and I feel good after. And then you just have a better health regimen in general. And then people are like, wow, chiropractic care is like a part of my life. So, you don't go to the gym after a couple days and expect a six pack. So it's kind of like you go forever to the gym because that's part of your health regimen. So that's kind of our goal, is to see you the least amount, but still keep you in a good spot where we don't have to go back to that pain-based model and just live in that function and wellness.
Yeah, and we're always going to meet our patients where they're at, right? If someone does come in and they're like, I just really need this to be fixed, like we're going to help them in that sense, right? We're going to get them out of their pain that we want. But what we want to just try and promote is just, like Bethany said, is just that overall health and wellness, just be a part of their like health journey with them, and sometimes open their eyes to better opportunities for their bodies, kind of thing.
Mm-hmm.
So, yeah.
I think we're always in this fight or flight stage, or this pain base, that some people don't realize how healthy they can be or how good they can feel. And that's normally where we get with people. They're like, wow, I actually feel great. I didn't know I could feel like this. And like, you want to stay in the great, you don't want to revert back. And, we're probably doing the same things at home, in the sense of you can't quit your day job, you can't do some of those things. So it's like, what have we brought to you? And like the adjustments just regulate the nervous system so well and help people live a healthier life.
Yeah, I think that's probably my favorite catchphrase from people, is just like, I just deal with this. And it's like, we don't have to deal with this. Like, you can live a normal life. You can live, like, your body can feel good. And like Bethany said, I think that's probably one of the more satisfying things when you hear people be like, oh, now I can understand where my body feels good and when it doesn't.
Yeah. What's a common misconception in the chiropractic world?
I don't know.
I think probably in our office, we have the little clicker thing. It's called an integrator. That's what we use for torque release. We'll have people look at that and be like, I mean, you can do it, but it's not going to do anything. And we're like, okay, like that sounds great. Like we're going to do it. You know, we're going to get you adjusted as well manually with a snap, crackle, pop. But it really does something. It really hits it. And then like we'll have people who, you know, there's maybe not getting the results with their neck headaches, stuff. And we're like, okay, let's just try the integrator. And then they haven't had a headache in like a month. And it's like, you know, we know it's doing something, but it's hard to explain that, like, how does this little thing that pokes me in the neck actually help me? But it's with just like time that people really see that, hey, that's really benefits me.
Yeah. I guess I would say like the one is like everyone always like says like, oh, and this goes back to like their health journey and all about, but like everyone always says like, oh, they just want me coming back kind of thing. And it's like, that's more of like, I think most chiropractors, and maybe it's just not communicating it properly, is just like we said, we just want you to feel great. Like we want that health journey to continue kind of thing. And whatever sense it is of like, yes, we kind of want to maintain you in that sense, but if it means you maintain it 1 month, 2 months, whatever it kind of is, but there's no chiropractors that's like, I need you to come back in kind of thing. It's more of, we want to help you.
Yeah.
Kind of thing. Yeah.
As a married chiropractic couple, who adjusts who?
That's a good question. I'm currently pregnant, and so Dr. Sierra's been adjusting me more. Devin did adjust me today. So since Dr. Sierra's been here, I feel like we kind of intertwine, all three of us. But there is a thing in chiropractic that you're not supposed to adjust the people you love. I don't know why, but they say that. But we have been adjusting each other since we went to school together. We started adjusting each other. So we've kind of been doing it. And our son loves to be adjusted. So obviously we both love him very much. But he hops up on those tables, no problem. But so...
Yeah, we both adjust each other. We try and adjust each other weekly and everything like that. That's kind of one thing. I feel like the one phrase or whatever, people are always like, oh, you must be so happy. You're so lucky that your wife can adjust you. And it's like, yeah, it is pretty nice. Like if I have neck pain, I can get adjusted right there. Yeah.
Right.
So
that's funny. So once you got started and started to grow, how did you guys decide on, you know, how we're going to grow our team next and how we're going to keep that experience that you guys offered as you grew?
Right. I think the one thing with our office and something that we really wanted to do right from the start was like, we wanted this to be like a welcoming environment for our patients to come in. We don't want you coming into like, oh, I'm going to the doctor, right? We always talk about like, we want to build like a community inside of our office and we want that to be as welcoming as possible. So I think when we started going through the hiring process, right, we wanted to find those people that when you go to the front desk, you kind of feel warm talking to, right? It's not like, oh, I got to go up there and talk to them. Our patients like to come up to our front desk and talk to them. There's some times where we're waiting for them in the adjustment room and they're like, oh, I'm still talking to your guys' front desk girls, because it's like they're enjoying their time here. So I think that was a big thing, is like we want our office and our employees to be more family than employees.
Yeah, and I think, you know, each step as you grow, you know, there's a hindrance that if you don't grow your employees, your company inside, you can't grow outside. So that was one thing that we really looked at, of like, okay, like how are we managing everything in here, and like, are we doing it okay, or do we need to expand on there? And luckily we now have Tiara and Grace up front, and they are, you know, 5-star employees. So that's been really great and really a great blessing to the office, because, you know, we'll have people come back and comment just like, oh, how great is your guys' staff? And we're like, yeah, it's great. And it's nice to come to work and enjoy your employees and your coworkers, instead of being like, oh, I have to see that person again today. But so I feel like we really try to figure out that niche of like, how do we hire someone to make them a part of our family and make Northern Peak welcoming and everything like Devin said. And then also like when Tiara's been here for 3 years now. So, when we hired our newest hire, Grace, it's like we wanted Tiara's input. We wanted Dr. Sierra's input. Like, how are we going to find the best fit for all of us so we can continue to serve more people and give back in a chiropractic manner? Specifically hiring Dr. Sierra, it kind of just fell into our lap. We knew that there was a girl from Watertown that was about to graduate. We kind of knew a little bit about her. She went to Northern, I went to Northern, but she was a little bit younger. And so we're like, well, let's just like reach out and introduce ourselves and see if we would even be a good fit. Because that's, quite a challenge just to find a good fit associate wise. Because like you love on these patients so much and then you hand them off to someone else that you're like, oh my gosh, that person's like family to me. And now someone else is going to take care of them. And for me, it was really hard at first to let go, especially some of those like moms and babies where it's like, gosh, I've been seeing this baby since they were 5 days old and now I have to give it to someone else. And so when she came in, we were like, okay, I think this is great. It was a great fit from day one. I mean, we couldn't have been happier. And I think Tiara can also agree with that, it's like we're so much more of a family in here and friends than just like your day-to-day coworkers.
Coworker.
So would you say it's more on the hiring side? That's where you guys put your focus, or maybe a different business owner should focus on the hire side of like, or is it more, are there still things you do once these folks are hired to keep that same atmosphere? And
I think it's a little combination. I think though, like the biggest thing is like, and you hear this all the time in like the sports world and stuff like that, but like the culture of your office and stuff like that. Like we know someone's not going to be probably a good fit if, they're quieter, or I don't know if outgoing is the right word or what it is, but the culture that we kind of built in here of like that loving side of things, if that isn't quite there, then it just wouldn't probably work out. So I feel like the culture inside is important.
I feel like as we've gotten further into practice too, we've been pickier with our hires. We want someone to really fit the niche. We're not just hiring to fill a spot. And then as we've gone through, a couple hires, it's training. You have to train them. You can't just let them to the wolves. And some days you do get thrown to the wolves, but it's like you got to start at ground zero with them and help them build success in your office. If they feel successful, then they're going to bring that into the environment and have that positive energy through there as well.
Mm-hmm. I'd probably say like as like being younger side of it while we grew this business, that's probably one of the things that we learned as it was like, okay, we do have to do some pretty hardcore training at the start to get this going in the right direction and stuff like that, and trial and error like everyone when they're going through and growing as a business. But I think as us as business owners, we had like the outside of it of like, okay, we know what the culture, we know what we want to do with our patients and our employees. How do we get them to that point? And I think that's an area that we've really
had a finish line, but trying to start and finish, get there was sometimes a challenge, but I think we've gotten a lot better. But you can definitely tell with like people who want to be here, want to serve other people, we all have the same goals. That really helps, build a good environment, good culture.
Yeah. One question that's super relatable to small businesses in general, and a lot of small businesses are family. You guys are husband, wife, busy on the business side together all day, also trying to balance life side. How do you guys do that? Is there any like things that are important to you that you're like, we need to do this? Or
I think that was one thing like at the start of this all, like before we decided to grow our family and stuff like that, we were like, we're just going to grind at the start. So like when we first started off, we were almost like every weekend, we were either doing an event around this town, or we were actually going to like a chiropractic seminar to get better on the business side of things. So that in those like first couple years, we were like, okay, we've set the base of what we need to be. And then from there, I think now that we've grown our family, we're like, we want that time on the weekend. So it was like, we really made sure we worked hard to build this up so that when we get to that point, we were able to kind of take a little bit of time off. And then that's also where Dr. Sierra came in too. It was like, she gives us the leeway to be like, oh, we got to go pick up our son. Can you cover for us? And vice versa. Like if a kid's sick, yeah, that's no problem. Go home. Like that's really important for us. So.
Mm-hmm. And I think too, people always ask, you work with your husband? And I'm like, well, I don't hang out with him most days. He's in one room, I'm in the other. I probably talk to Tiara, Grace, and Dr. Sierra way more than I talk to Devin throughout the day. And he's kind of the quiet one out of the group in reality, but so it's not like we're, sitting, hanging out all day, but it has been really nice, I think, for like our relationship is we eat lunch every day together. Like something super simple that, when we have wells around, it's like someone's cooking, someone's chasing wells. Like we don't get that time. So I think it has been like a really great thing for our relationship too, to be able to spend some time outside of like the house together, even though it's here, but that's okay.
Yeah, and I think one thing too, like people are like, oh, like Bethany said, you work with your husband, you work with your wife, and it's like we both have the same passion, so it's like really easy to. It's honestly sometimes hard for us to turn off work when we're driving home and stuff like that, but it's like we have the same passion. We know exactly kind of like the direction our life's going in, and that's so much easier with your partner because it's like we got the same goals in mind.
Yeah.
So.
Aligning on those can be crucial. Yeah. So you guys had mentioned seminars and how those are important. Is there anybody or any education out there that was important to you guys getting started?
Yeah, I mean, there's been quite a few. Obviously, with TRT, you have to get trained in that. So, like Dr. Holder, he's the big head honcho in the TRT world. And then the pediatric side, Dr. Tony Ebel has been really great to learn from and kind of guide people through the pediatric side, the pregnancy side. And then our mentor in the cities, Dr. Pete, he, I would say he was like the business guru for us, where it's like it kind of let us just focus on the chiropractic side and just like us getting out into the public and being present in our community. And then he was able to do some of the business side on the back end for us, where we didn't have to worry so much about that.
Yeah, and we to this day still have our weekly conversation with him, or maybe sometimes 2 hours, just all the way from, okay, how are you doing with your adjusting, to like, what's our next step business wise. So he's invested in us very like heavily in the sense of like, where can we get you guys to get to that next level kind of thing, and he's always pushing us to get better and better. So I would probably attribute a lot of our success to Dr. Pete.
Yeah, I think that's a common thing that we find is if these folks that found a mentor or had a mentor, most people have mentors, but especially the ones that either seek them out or the ones that are connected, builds businesses much quicker. So that's cool. Are there any tools or software that makes your life much more easy so you can focus on building the business? Or
yeah, I would say Sked.
Yeah,
it's our texting scheduling app. So you have it on your phone, you get it downloaded on your third visit, and you can change appointments in there, you can move them around, you can add appointments, you can directly message us, and so they'll pop up on the computers for everyone to see. So it's just an easier like direct communication with us where you don't have to just call a phone. So say you're in a meeting and your meeting's running late, you just pop into the app, change your appointment around, and then that just changes it for you, so you don't have to even step out to make a phone call. So especially like I was talking about moms and babies and dads too, or men in general, but people have busy lives. It doesn't always work to come to your appointments when they're scheduled, and we notice that like if you don't have that flexibility with them, it's hard for them to find the time to make time for themselves. So we're trying to mitigate any of that, where it's like, let's make it the easiest, smooth streamlining where you can just not worry about scheduling for you.
Yeah, and I think the number one most like professionals will hear is like, oh, I don't have time for that, right? Or like, oh, it didn't fit in my schedule. Well, we're trying to eliminate that as best as possible. I think our record might be like, we've seen a patient reschedule in one day 8 times. And it's like, we don't know that though until we look at the very end, and it's like it's just so handy for people that that I think that's maybe one of our biggest compliments. It's like, oh, you guys are so convenient in that sense. And that's why we have 3 of us too.
Yeah.
So.
What is an investment either on the personal or business side that you guys have made either individually or together that has tenfolded that what the investment was for you guys?
I would say finding a good mentor. You know, I don't think you can ever repay that person enough to what they brought to the table, what they've guided you through. I mean, obviously at the beginning, a mentor you maybe call a lot more frequently. And now, like Devin said, it's once a week, every other week type of thing. But I know that like it helped us jumpstart so much quicker. And there were days where, you know, we talked about going business to business at the beginning. I didn't want to do it. He didn't want to do it. But like, we're like, crap, our mentor is going to like be checking in on us. Like, we need to do this, you know. It helped so much in that sense too, where it's like, it's not just us, it's someone else like checking our numbers, making sure we're heading in the right direction, doing what's right for our business, our patients, everything like that, our employees. So I think that was one that I would say, you know, it's not a direct investment or anything, but I think it's been the best thing that could have ever happened to us.
Yeah, I think that, and maybe just ourselves, kind of like investing in ourselves. Like you hear all the time, like, well, when we got out of chiropractic school, like that's the number one thing is like, do you start a business or not? And then you get all these stats of like chiropractors are unemployed after 4 years or whatever it is. 40% of chiropractors don't have successful businesses, and it was just like, okay, let's just focus on ourselves here at the start. Let's kind of put our blinders on and just go to work, and seemed to work for us. So,
what is one piece of business advice that you disagree with? That's common.
I feel like my dad's a dentist, so he has his own business and they have little fun businesses here and there. They just always told me, just work harder. Just work harder. I think you got to work smarter. You have to, you know, you have to get out there, put your boots on the ground, but you have to do it in a smart way, or you can just spin your wheels in circles and not get anywhere.
yeah, I think something kind of like that, in the sense of like, you know, everyone kept saying like 5 years. 5 years is when your business will take off, right? And I think, why do you have to wait 5 years, right? Like, just like, if you have the time and everything, put as much effort into that thing. Like, we always, when we were at seminars and stuff, you'd hear like, oh, I do this job and this job. And we talked about that. Do we have to pick up another job to kind of pay these bills? But it was like, let's just focus on our thing and just hit it full on. And instead of 5 years, have profit in a year, kind of thing. So, yeah.
You guys had mentioned nervous system scans. Kind of, yeah, what does that look like, and what information are you getting from those?
Yeah, so they're very, very complex. I feel like they're sometimes difficult to explain, but it really gives you a better picture of your nervous system and how it's functioning. On our day one, we do a good health history, do those scans, and then explain them to you. And it really shows where our body is functioning at the moment. So, you know, it's like, hey, how much inflammation do we have in our body? How much tension do we have in our body? How resilient is our body? Are we in fight or flight? Are we in rest and digest? So we go over that completely with the patient, and it's like, sometimes people will have pain in their hip, but then they realize like, hey, there's stuff going on in my neck actually that's causing me to have a poor immune system. So, you know, it really helps us get a better picture of not only like where to adjust, but what are extra goals for the patient as well. Because a lot of people come in and say, I have low back pain, I have neck pain. And it's like, oh, well, your scans kind of lit up around your mid back. Oh, yeah, I have acid reflux too. And it's like, so then we can kind of dig into a little bit deeper of like maybe things that people don't know chiropractic can benefit from. Then we can explain the scans to them and where we can help them. And then moving on, we do re-evals. We do scans throughout the way to make sure we see improvement with them. So
yeah, the technology is called CLA. It has 3 different sides to it. Like Bethany said, there's a inflammation scan that just checks for heat on your spine. And then there's a muscle tone tension that send signals through the muscles to vibration of like how much tone there is there. And then there's a heart rate variability. I think the nice thing about it for our patients is, you know, when you go to a chiropractor or a medical doctor, whoever it is, you know, they tell you what's going on, right? Where at these scans, you can actually see like, okay, it's not just someone telling me, this is like an actual scan / score I can look at and see, okay, it also holds us accountable in the sense of if we do these reevals, when we do these reevals, are these scans getting better? And so then we know we're going in the right direction with them too. So.
Man, I don't know if I want to get this scan. Well, we want to thank Dr. Bethany and Devin for giving great insight. I hope you at home learned something. We'll have their information below, above, to the side, and check them out, and we'll catch you next time. Oh, you get enough?